Welcome to the live stream. Somehow I got bumped off, but guess we're back on now. Thanks for joining. Oh, let me put my phone on do not disturb mode. All right, maybe that'll be a little bit better. Sorry if you got kicked off the stream. Not sure why that happened. But for those of you who don't know, I'm an orthopedic surgeon. I do a lot of hip and knee replacements. Just on here, going to answer some questions, pick up where we left off. Sorry if you were in the middle of a question before and it got cut off. Not really sure why that happened, but if you drop a question in the chat, I'll go ahead and answer it. Hey, thanks. I appreciate it. You know, all the support for the channels and the streams has been excellent so far. So I appreciate it very much. Not sure why the room got blocked, but we'll go from there. How many years of residency do you have to do? So every specialty is a little bit different. For orthopedic surgery, it's a 5-year residency program. And you do 5 years of orthopedic kind of general training, and then you do a specialization. Are all your patients weight bearing is tolerated after hip and knee replacement? Yes, all my patients are weight bearing is tolerated after their hip and knee replacement operations. Hip replacement recovery time. So most of the recovery is within the first kind of, I would say, 8 weeks or so, but people make improvements even 6 months to a year after their operations. You know, the good thing is, depending on what type of hip replacement procedure you have, it could be a minimally invasive procedure where less muscles are cut. Then you may be getting back to recovery a little bit quicker in the short term. And so that's the recovery. I go into a lot of detail kind of on specifics and recovery in my guides. I have a 32-page guide on knee replacement and hip replacement. That is both on my in my link in my bio. Yeah, so I don't think I was banned. I'm not really sure why it kicked me off or why it said the room was blocked. It seems kind of odd why that happened. Do you recommended braces or orthotics after a laminectomy? Let me see if this is working. It depends. It depends what kind of back procedure you had and what the recovery is and what they're waiting for. If they're waiting for the back to fuse, then that could be a reason to do it. Hey, after the hip replacement, how often is therapy? Therapy is usually every day after a hip replacement surgery. Let's see if that works. Okay, it says we are live. All right, edit. Let's edit our public. All right, let's see. Maybe that'll work. All right. Let's get to a couple more of these questions. Had a total knee replacement last month due to osteoporosis. My femur fractured. Very sorry to hear that. That is not good. That is probably one of the worst things that could happen during a hip replacement operation. Very severe complication of a hip replacement. So there's certain things you can do if the bone is fractured when you have a hip replacement. Like if it's broken, then you could go back in there and put cables or put and then put a new stem in, and so that can be helpful. Are your hands insured? I have disability insurance. I haven't specifically insured my hands, but my whole body is insured for disability. Let's see what else. How's the house project going? So for those of you who don't know, we're building a house. It should be, demolition's supposed to happen in like a week or two. So hopefully that ends up happening, but it's been really a big mess for the house. We have our plans completed. We have everything kind of set up, but we're still picking out a couple things out, but the overall structure is confirmed. We're just waiting on kind of the final permits. What causes your knee to burn and sting? Burning and stinging is, I'll post house updates along the way, and but it's been a journey for that. Sudden onset of intense pain in the hands and feet. Tendon pain. Any ideas why? Not sure why. Usually when you have really bad pain like that, it's most likely due to burning. nerve and nerve issues. So burning issues are usually nerve related. I broke my hip and I'm 59. It's slow to heal because of my age. There's a lot of factors that affect bone healing: vitamin D, calcium, making sure that your bone health is pretty good. What's the difference between osteoarthritis and osteoarthrosis? So we say osteoarthritis, but arthrosis just means part of the joint. So it's basically the same thing. Same thing, just two interchangeable meanings. Tough decision whether to go ahead with a knee replacement. I have really good guides in my bio. Hey, what's up, Rosanna? Thanks for joining. Appreciate it. I have really good links in my bio and guides for hip and knee replacement. So if you have a lot of questions, the other thing is I have a Discord channel. If you need to ask specific questions, you can always drop them in there. Do you always have to have surgery for meniscus tear? No, you do not. Meniscus tear, I would say most of the time, don't even require surgery. Are there stages to spinal stenosis? Yes, you can get more severe spinal stenosis. It can lighten up. It can go up or come back down based on how severe the spinal cord is compressed. Dr. Harb, how long after a right total knee replacement can I take a 10-hour flight if I get up and walk periodically? So every surgeon is different based on their specific needs. So for my patients, some of them travel pretty early after surgery. I would say 4 weeks is a good time frame. If you're traveling just for surgery, you can fly as early as 3 days after the operation. I do keep my patients on a blood thinner though, and so that helps prevent blood clots. If you are going to take an early flight, I would recommend getting up, doing ankle pumps, moving around, stretching on the flight, trying to get up and walk every hour. 4 weeks is an okay time frame for a domestic flight. If you're going international and you're going to do a lot of walking when you're there, then 2-3 month mark may be a little bit better. Do you work at one hospital or move around? I work at one main hospital. I'm at Sibley Hospital, which is part of the Johns Hopkins system, and I go to a couple different surgery centers as well. I had a knee replacement. I never recommend limb lengthening. Amputation will save you so much money. Yeah, I agree with you. No limb lengthening. Limb lengthening is something that's marketed. It can create more problems than it will fix. And there's a lot of other things you can do. Is rib cage contusion a long recovery? Yes, it can be a long recovery, sometimes even 6 months or so. Any bone contusion can take a long time to heal. I'm a multiple myeloma patient. Is there any way to fill the holes and fractures caused by it? Very sorry to hear that. Multiple myeloma is a very difficult disease. It makes your bone look like Swiss cheese. There's different medications that can kind of curb the multiple myeloma. You want to prevent the complications that can happen from the multiple myeloma. There's different things like parathyroid hormone therapy, which can be helpful. Sometimes we'll put you on a bisphosphonate medication. Sometimes we'll prophylactically put a nail down the bone, which means to prevent a fracture. Those are all things we do to try and prevent fractures in multiple myelomas. But to fill in the bone, it can be very difficult. Let's see. Post total hip 2 days ago. My bladder's still holding on to about 50 ml. Still quite a bit of pain. Very sorry to hear that. Are you in the hospital still? Usually we don't discharge you unless you're urinating. So part of it depends on what spinal medication you got. I use there's one spinal anesthetic medication that creates, it makes it more difficult to pee after the operation. So I use a short-acting spinal called lidocaine. It's very quick on, very quick off, and that can be helpful. Psoriasis be gone. I agree with you. Get rid of no psoriasis. We don't want psoriasis. How do I prevent feet swelling during a long flight? Get up, move. So the reason the feet swell is because your venous blood gets congested and trapped in your lower extremities. So obviously you can't elevate your feet and keep them way up high on a plane flight unless maybe your whole row's open next to you. But you could do ankle pumps, meaning move the feet up and down when you're sitting. You can get up, walk the halls. You can wear compression stocking on the plane. What's the youngest knee replacement you ever done? I would probably say maybe around 25 years old. So what I would Oh, thanks for the fire, John. For multiple myeloma, you should probably see a hematologist oncologist, and they'll know all the meds you can take. You may also be better seeing a endocrinologist as well, and have two surgeons on board. The endocrinologist can prescribe Forteo, or it's called recombinant parathyroid hormone, which can help build back bone. And then there's other medications they can put you on for bone health called bisphosphonates, which can be helpful. 59, I broke my hip. It's taking a while to heal at my normal age. Very sorry to hear that. There's many factors which determine bone healing. And if you have questions, just drop them in the chat, either on YouTube or on TikTok, and I'll get to them. But there's many factors that affect bone healing. Other medical conditions can affect bone healing. Smoking can affect bone healing. You can take a vitamin D calcium supplement. There's 2,000 to 3,000 IUs of vitamin D plus 1,200 milligrams of calcium. I have a link to that in my bio if you're interested in vitamin D treatment. But there are many things you can do if your bone's not healing. Now, there's other factors, meaning surgical factors, that can affect your bone healing as well. Meaning if your bone is not aligned, then it's going to be a big issue where the bone may not heal properly. What are your take on orthotic insoles post-ankle surgery? I think they can be helpful. There's a brand called Superfeet that's very good. I have a link in my bio for Superfeet. They're very good. You can... let's see. You look like Patrice Bergeron. Okay, I'm going to have to look him up. Let me look up what Patrice looks like. It's so funny because so many people say I look like different people. I guess so. Is he a good-looking guy? Any tips to help neck and shoulder pain after radiation treatment? It depends what exactly happened with the radiation treatment and what areas it went through. It can really affect the rotator cuff. It can make a lot of swelling in the shoulder. If you're having a lot of shoulder issues after radiation therapy, sometimes injections can help, or anti-inflammatory medications. But thank you for all the double taps, likes, follows. I like doing these lives and answering questions because a lot of people don't get all their questions answered when they go to the doctor. So this gives you an opportunity. Obviously, I'm speaking in generalities. We'll be getting a new hip soon. I live in an upstairs apartment. Will I be able to come home after surgery? Yes. So I operate on a lot of people who they're up and they're walking, and they do stairs before they leave the facility, actually. I need a meniscus repair, but I can't afford to be out of the work for weeks. Any recommendations? That's a tough one. So, is there something that your work can do? Meaning, can your work put you on light duty, or can your work put you on a desk job or remote work? And so many of my patients, for example, like if you're going for a hip or knee replacement, especially in DC, people run their own businesses. So some people go back to remote work even a week or two after their operations. Is there a surgery to even out your shoulders? I have scoliosis. With the curve in your back, that can affect your shoulders. Without doing a fusion to straighten your whole spine, then it becomes very hard to do that. Who takes care of a scar revision? Well, it depends who did the surgery. If it was like a scar revision for a knee replacement, the thing is, whenever you have an area of your body you move a lot, the scar tends to get very wide. And but a plastic surgeon could do a scar revision. An orthopedic surgeon could also do a scar revision. Hey, Mayo, let's see. Okay, we're not going to read that comment. That comment doesn't pass the vibe check. We're going to move on from that comment, but I appreciate it. I appreciate your support for the stream. Do you recommend epidurals for spinal stenosis? Usually epidurals are for a pinched nerve. 2 ACL surgeries. Let's see. 1 in 14, 1 in 17. Still have bad days. What do you recommend? If your ACL's bad, your knee's going to have instability and wiggle back and forth. If the knee wiggles back and forth, then that can be a big issue as far as future arthritis or developing problems down the line. So if it's instability, you could do a replacement for more stability. That is one option. but I would only do a replacement if you have arthritis, meaning if you just have 2 ACL surgeries and you don't have arthritis, then you're not a candidate for a replacement. Treatment options for combined FAI when PT doesn't work. So they could go in there with a camera to shave it down. They could do a hip injection that's not curative. That's only short-term relief for labrum tear. Or you could go for a full hip replacement if you have arthritis. What's good for my bunion? Wear shoes with a wide toe box. It depends. And then the other option is if your bunion's giving you issues, get a corrective operation. What are your thoughts on chiropractic care? From Haley. I think chiropractic care can provide relief to some patients. I don't discount it. I do have a lot of patients who go for chiropractic care who get relief. Now, it's not what I recommend firsthand. Usually I'm recommending other things like physical therapy. But if you do go for chiropractic care, do not get your neck manipulated. That's the biggest biggest thing that I say to avoid, because you have arteries on the side of your neck, which can cause a lot of issues and give you a lot of can give you actually a stroke if they pull too hard on your neck. What helps in hip impingement? Hip impingement can be helped by physical therapy. Hey, what's up, Mir? Hip impingement can be helped with physical therapy. Now, it won't be cured, but you can decrease the symptoms. NSAIDs can help. Anti-inflammatories can help. And then there's other things like if it doesn't get better, you could shave down the bump, shave down the impingement, or fix the labrum. And then an end-stage treatment for hip impingement would be like a procedure, a surgical procedure. Hey, from Africa. Wow. We got all across the world. Incredible. Let's see. All right. We got a lot of these. Thoughts on robotics for knee replacements, tips for recovery. There's no advantage of a robotic versus non-robotic knee. The problem with the robotic is you need extra pins in the bone, and you have a bigger incision, or you have an extra hole or poke hole incision. The procedure can be a little bit longer, so I only do robotics for very bad deformities. For just my routine knee and hip replacements, I'm not using robotics. Achilles tendonitis treatment, you can wear a shoe with a little bit of a wedge in it, a boot if it's really bad, and then if it's so bad you need surgery, you could detach the tendon and then reattach it back into bone. Do you do anything with Kienbach's disease? So my partner in my practice does a lot of the wrist operations. There is a procedure where you can like drill to try and revascularize the bone if it gets really bad, and so those are kind of the treatments for necrosis, trying to increase blood flow. But for me, I do a lot of minimally invasive same-day hip and knee replacement operations. I really wish I could stream a surgery because I think that would be really enjoyable, but gotta abide by these guidelines here. Surgery tech here. Thank you for all you do. I should say it the other way around. Thank you for all you do. I'm sure you don't. We should be more thankful as surgeons when we have good staff. So appreciate it. Really bad pain behind my right knee on the outside. Sorry to hear that. There are things that can form in the back of the knee called Baker cysts or fluid in the back of the knee that can build up, and that can get pretty painful. Recommendations for bursitis in the knee. Bursitis can be treated with an injection if it's really bad. Meniscus surgery in May, still dealing with popping and catching. Could always get a repeat MRI, could try an injection in the knee. Opiates are safe. Oh, St. Lucia. Wow, nice. I went to St. Lucia. St. Lucia is a beautiful place. Awesome. Where is your office located? I'm in need of a knee replacement. I'm a lineman. How long would I be off? Are you an ex-lineman? Or are you still playing lineman? Could you stream one on YouTube? I am streaming on YouTube right now. So I'm dual streaming, meaning I'm streaming on TikTok and YouTube at the exact same time. So that's something I've been organized. I wish I could show you guys my setup. There's wires like everywhere right now. Hey, what's up from Virginia? Yeah, I'm in Virginia right now, but I'm dual streaming on both. Answering questions on both. As a surgeon, how do you remember everything you've learned? Well, you learn a lot, but it's what you do every day. So when you do the same things over and over, it just becomes second nature. Opinion on Zimmer Biomet total ankle. I haven't had a lot of experience with total ankles, to be honest. I do mostly hip and knee replacements, but they are making better total ankle systems that are creating better longevity and better outcomes. At this time, I was diagnosed with Charcot. Charcot is a difficult condition to deal with. It's when there's a couple different types of Charcot. Some people can get Charcot joints from diabetes. Some people can have be prone to developing disease if they have underlying called CMT. And so, depending on what's wrong or why it's happened, it can be very, very debilitating. Sometimes we just fuse the joint together if you have Charcot. Sciatic nerve. Thank you for the follows. Let's see. Hobo and Tanny, I appreciate the follows. How long does a knee operation take me? It takes me about an hour to do. Meniscal root repair in October. My knee's still bothering me. That's a long time. It may be helpful to get maybe a second opinion or get a repeat MRI. DRG sounds like DRG is dorsal root ganglion, some procedure for a chronic regional pain syndrome. Anytime you affect the sensory nerves, it can sometimes, affect things, make things a little worse. There are desensitization procedures for chronic regional pain syndrome. Am I in Nebraska? No, I am not in Nebraska. I am in Washington, D.C. and Maryland. Nerve zingers after total knee replacement. How long does that last? So the nerve zingers are your skin nerves healing back together. When your skin nerves when the incision's made for a total knee replacement, some of those skin nerves get a little irritated. And if they're a little irritated, you'll feel zingers when they're healing back together. And so that can be helpful. Hip replacement for leg Perthes hip with a 1/2 leg difference. For me, it depends. How long have you had the Perthes? Yes, most of the time I try to bring the hip to equal. Sometimes I'll bring the hip to about like 75% of equal. There's a little bit of a gray zone for when you're restoring limb length. The problem is if you go from short to equal, you feel a lot longer on that side, and sometimes the soft tissues are too tight. So I aim for about 75 to 100% correction. Yeah, hey, what's up, Golden Girl? I'm in Baltimore. So I'm in Germantown as well as Washington, D.C. I work for Hopkins as well. So there's Hopkins in Baltimore as well. Or I work at a Hopkins facility, so I'm associated with them. Who would I go to for a hip replacement if I needed one? That's a question I haven't really thought about. I don't know. I don't know who I'd go to. Posterior or anterior total hip? I do a lot of direct anterior total hip replacements. I do posterior hip replacements for my big revision cases or my very, very dysplastic or conversion surgeries, but most of my surgeries are direct anterior. My mom has a shorter leg now from hip. That would be odd. Most of the time we're not making the leg shorter. Most of the time we're making a little evening it out or correcting the missing cartilage. Medial epicondylitis treatment. Medial epicondylitis is usually when you're still growing and, the growth plate can be irritated. If you're talking about like, that's one time you can have it. Or the other one would be like golfer's elbow, like a lot of inflammation right over here. You can do injections for it. Sometimes you can do splints. In the worst case, you could do a debridement. I would probably get nerve conduction studies to make sure nothing else is going on in that area. You have a nerve that goes right in here, your ulnar nerve. Do I do opioid-free surgery? I don't understand what all this opioid-free surgery is. For me, orthopedic surgery is major surgery. All of my patients have a prescription for oxycodone. They have it if they need it. I would probably say 50% of my patients take their oxycodone. The other 50% never use it. But all of my patients have narcotics after surgery. End-stage osteoarthritis in the shoulder, no pain, surgery always needed? No. There's two criteria for a joint replacement. The first criteria is, one, on imaging, you have arthritis. The second criteria is that you're having pain and dysfunction. If you don't have pain and dysfunction, then you don't need a replacement. What percentage of your practice is arthroplasty? I would probably say 95% of my practice is arthroplasty. I do take some orthopedic trauma call. Thank you for the follows. Appreciate it, Kim. Let's see what else we got. Pain meds, 3 to 4 days, tops, so dangerous. Many folks have issues. How do you manage? Need versus addiction? So all of my patients get this specific protocol where they're on Tylenol and Celebrex. They have Tramadol for breakthrough pain, and then they have oxycodone for severe pain. I would say many patients that I operate on are not taking the oxycodone, but they have it. For knee replacement, would you do them both at the same time? How hard would recovery be? I do one at a time usually. Music choice in the OR, I usually let my physician assistant or my nurses or scrub techs pick. Is there a minimum age for joint replacement? There is no minimum age. Are you familiar with double crush injury? Yes, I am familiar with double crush injury. Thank you for the share of the live. I appreciate it. Haley. Damn, you need to get off TikTok, Doc. I just do these live streams for like 30 minutes to an hour, maybe 1 to 3 times a week. I don't think I'm on TikTok too much. It's usually after hours. Usually all my work is taken care of, so. Bone growth stimulators. They can help to repair the bone. Yes, they can. What are the odds of re-tearing an ACL? It depends how your ACL was fixed and what was used to fix that ACL. Different grafts have different levels of failure. Why is my arm longer than the other one after shoulder replacement? That would be very uncommon to change the length of the arm. And so many people can live just fine with arms that are unequal length. So that's really, it shouldn't matter functionally. Okay, Ortho Life asks, what is the best place to do fellowship arthroplasty? Well, University of Virginia, of course, where I trained. So that's obviously the best place. Hope that answers your question, and hope you match successfully there. I'm a med student looking to go into ortho surgery. What is your favorite surgery? I love doing hip and knee replacements. It's awesome. Any advice for rad techs in the OR? Just get good. Like for me, I use a lot of x-ray during my direct anterior total hip replacement, so just get good at getting the views. If you know what we're looking for, when you're shooting an x-ray in the OR, it's easier to get the x-ray. So if you're not 100% sure what we're looking for, it can be helpful. It's awesome. UVA is 20 minutes for me. Yeah, so I did my fellowship training at UVA. I'm currently in Washington, D.C., and I have an office in Germantown, Maryland as well that I go to. Have you come across RSD? Yes, I have. Where do I practice? Washington, D.C. and Maryland. What do PAs do for the orthodoc? They do a lot of things for me. So they see patients in the clinic. They help me pre-op and get my patients ready for surgery. They help me round on my patients after surgery. They help me in the operating room. So different states have different rules, and PAs can basically almost operate in a similar regard to physicians seeing their own patients, having their own clinics, and being very helpful in the operating room. Can you do the other knee after 3 months? Yes. So I'll operate on someone's other knee even 4 weeks after the operation. Favorite replacement, Zimmer or J&J? I don't use the J&J replacement. The Zimmer knee, which is called Persona. Persona is a good implant. I do a lot of DJO and Stryker. My son just had nursemaid's elbow. Sorry to hear that. Hopefully they popped it back in with no problem. When I lie on my side, I have pain on the front and side hip of pelvis, is it bursa or sciatica? So sciatica you usually feel in the back, like in your buttocks area, whereas bursitis you usually feel on the side of your hip, and arthritis or labrum you tend to feel in the groin. Should I worry that my knee still pops catches 3 months out from a meniscus? It's hard to say. If it's the same symptoms you were having before, you may need a revision meniscus surgery, but I would probably give it a little more time to heal. Can hip impingement heal without surgery? Yes, it can. What type of dressing do you use on your knee incision? So I do a plastic surgery closure. So I do a monocurl under the skin followed by a perineo on top, skin tape and glue. Then I do Mepilex. We use Mepilex. Mepilex pretty absorbent. I think the price is a little cheaper than Aquacel for our facilities. Yeah, physician assistants are wonderful. I agree. Do surgeons ever let other people take over during surgery? It depends. If you're where you're at, like if you have a fellowship program, you may have your fellows do a little bit of the surgeries, the easier parts, because you're training them to be surgeons. Now, for me, I see a lot of I'm in private practice, so I see a lot of private personal patients. So even though I am training GW and Walter Reed residents, I'm doing the majority of the surgery and kind of teaching them as I'm doing surgery. What is the risk of replacing a joint after a cortisone injection? So there's a theoretical increased risk of infection within having a joint replacement 3 months after a cortisone injection. The thing with cortisone is cortisone decreases your inflammatory response. If you decrease your inflammatory response and you decrease the same cells, white cells that react to bacteria and things like that. So that's why there's a theoretical increase of risk in doing a replacement within less than 3 months of a joint replacement. And I would say it's not even theoretical. There's papers that actually prove the complication rate's a little higher within 3 months. So will they fix the meniscus and ACL tears before the start of the knee replacement? No. Those do not matter for the knee replacement. You can have the knee replacement even in the setting of a damaged ACL and damaged meniscus. You do not have to get those fixed. Thank you, DTY5. I appreciate it. I like getting on here answering these questions. They're good. Yes, I do about 70% of my joint replacements same day. Patients go home the same day. How can I avoid infection? So it's a lot of surgeon dependent, meaning, decreasing the overall time of your procedure helps to decrease infection. Giving antibiotics before, during, and after the procedure, as well as doing things like antibiotics in the nose to kill staph. Have you done replacements on anyone with dwarfism? Yes, I have done replacements on people with dwarfism. This is awesome. I'm a workman's comp adjuster. This helps. Well, if I can be any help I can be to anyone. That's why I'm here. That's why I do these videos. No, so for me, like I said, I'm in private practice. I have private patients. I have people, I have residents who at the hospital setting, I do have residents who observe me operating, but at different hospitals, like at university settings or fellowship centers, it just depends on a surgeon-to-surgeon basis. But for me, I'm doing all of my operations. I also do telehealth appointments, so if anyone needs a second opinion or anything like that. And I have really good guides on my website for hip and knee replacement, like commonly asked questions and recovery and things like that. Oh, thank you, Carolyn. Michael Mann is going to replace knee 1 after a month after cortisone. So Michael Mann's been around for a little while. He does a lot of research, I think. So he was in Baltimore for a little while. He's now he moved around. He went up to Chicago, then to New York, and I think now he's back in Baltimore. My website is matthewharbmd.com/links. Oh, look at this nice hat. If you go to, thanks Ray for the hat, appreciate it. Yeah, he's back in Baltimore. Mont is back in Baltimore. But I have really good guides on my website. If you just click on my little profile, then you can go over to, yeah, so, not everyone, oh, check out these nice glasses. Thanks, Ray, for all this dress-up gear. Yeah, so, the end of the day, do a surgery with a surgeon that you feel comfortable with. I have patients travel from Baltimore, West Virginia, Virginia to come see me. I'm not that far away. I have some people even fly for surgery or travel for surgery. So, at the end of the day, find a surgeon you're comfortable with and who has a good track record. I think that's the most important thing. Where am I? I'm in Washington, D.C. and I have an office in Maryland as well. Oh man, Ray, you are really loading me up with these love focus. Lovely. Thanks, Ray. Appreciate it. After rotator cuff surgery, how long do you wait to do the other shoulder? Depends. You want to get good function back, meaning you want to get good motion. So maybe 6 to 9 months. No, she is not. She is a corporate event planner. I had a splenectomy 7 years ago and just recently had a blood clot. Could it be related? I would say probably not. There are some things to suggest that getting COVID has increased people's risk of blood clots. So it's hard to say. Blood clots can happen if you just have a higher risk. I recommend doing one knee at a time. If you really need to get both done, I could do them 4 weeks apart. Why did I go into ortho? I love doing procedures where people get better from them. And it's not like long-term cancer treatment or long-term medical treatments. Check out these shades. Thank you for the shares of the live. Thank you for all the double taps, likes, follows. Appreciate it. Let's see what else we got. With a broken hip, I seem to have a limp. The hip is bad and painful. Ortho thinks I'm too young for a hip replacement. Oh wait. Which is the main one? One leg is shorter and it can be fixed. So you can change a leg and make it longer at the time of a hip replacement operation. That's done very commonly. My son's 33, has Perthes as a child. The hip is bad. Ortho thinks too young for a total hip. 33 is not too young for a total hip. If you have Perthes, get a second opinion. If you're in another country that's outside the U.S., this is a common thing that I see in Canada and like the U.K., Australia. People are put off, but 33 is not too young for a hip replacement. What's the treatment of cubital tunnel syndrome for trauma? If it doesn't get better symptomatically with like a brace or some NSAIDs, you can get a cubital tunnel release. Is it common to tear a meniscus multiple times in the same knee? Not uncommon. It does happen. Check out this crown. Appreciate it, Ray. You are dropping gifts like crazy. Have you seen any ankylosing spondylitis? Yes, I have seen ankylosing spondylitis. People with ankspon are more prone to hip arthritis, so not uncommon to need a hip replacement. And it is an autoimmune disease, so it can cause worse problems. Thank you for all the follows. Appreciate it. Son has pain in shoulder while pitching. Do you think it's a tear? It's hard, especially when people are growing. It can be the growth plate. It could be the growth plate is usually the weakest thing in someone who's growing. So that's why they try to limit the number of pitches, especially in like Little League and things like that. Is Celebrex safe to take for arthritis? Yes, I give a lot of, Celebrex, Mobic are great medications for arthritis. What's the best knee replacement? The best knee replacement is one that is performed by a surgeon who does it well. There's not a lot, there's some brands that, don't get, but, there's, most of the brands have a lot of similarities and there's not big differences between overall recovery. How long do you wait to have a total knee after having a gel shot? We usually wait about 3 months. Do you do, it sounds like FAO or PAO? Periacetabular osteotomies, what's the average age for patients getting them? So periacetabular osteotomies, it's a really big operation. There's a lot of risks associated with it. I've seen people come in who don't heal from the operation. So it depends. It really depends on your age and what your joint looks like. New techniques for hip replacement? Yeah, so the biggest kind of development for hip replacement is called minimally invasive direct anterior total hip replacement. You're not cutting any muscles, you're going between the muscles. And because of this, people can get up, they can walk right away as well. Thank you, MV. I appreciate that. Yeah, she's been... thank you for this cowboy hat, Ray. Yeehaw. Thank you. I appreciate that. Yeah, my daughter wanted to get in a TikTok video, so I made one with her today. We'll see. I actually have a really funny blooper I'm thinking about posting tomorrow, so we'll see. We'll see. Where am I located? I'm located in Washington, D.C. and Maryland. Do I recommend a hip replacement over a PAO surgery? That's a great question. The hip replacement surgery is a lot more predictable recovery than PAO. You're up and walking right away with the hip replacement procedure. The PAO, you have to wait for bones to heal. It can take a little while. Having a previous surgery, if your PAO has to be converted to a total hip, the complication rate is higher. So those are all can be issues. Yeah, I have two kids, so not too young for children. Hopefully I'm just younger than I look. My daughter-in-law had her first hip replacement a few weeks ago. Her doctor doesn't want her to do PT. We're sending patients for physical therapy. I think it can be helpful. I don't think we're ready to make the jump to PT. The biggest question I would ask would be, are they doing that to save money? Because that's kind of what it sounds like. But most of our patients go for therapy. I want to do ortho as a specialty. How hard was it to match? Orthopedics one of the most competitive specialties to get into. I had a stress reaction, problems in my lower leg for 6 years. Why won't they heal? You could get in. Thank you, Ray. Appreciate it. Loading me up with gear. I had a stress reaction in my lower leg for 6 years. Why won't they heal? Hard to say. You could get an MRI. You could see if there's anything that could be done. In the worst case, if it's really bad and it's like a stress fracture, they could do a surgery. What's the shot you're giving week before total knee replacement? I'm usually not giving a shot a week before a total knee replacement. Usually 3 months is the cutoff for shots before knee replacements. What does anemia have with doing a second hip replacement quicker than 3 months? I would say anemia doesn't have very much to do with that. I can't remember the last time I had to give a patient a blood transfusion for doing a joint replacement. We use a special medication. It's called tranexamic acid, and it's very good and helpful to prevent blood loss. Also, the surgery, how you perform the surgery, if you're a good surgeon, you're meticulous with your exposure, you correctly make sure you get all the blood vessels that are around the area, then you don't have a lot of thank you for the heart hands, Ray. Then you don't have a lot of bleeding, and so recovery can be good. Iovera, so shot around the knee, Iovera, there's not good literature to support that. I'm not doing it in my patients. I've had a lot of people get that injection and say it didn't help that much. So Iovera is called cryoneurolysis. It's basically freezing the nerves in front of the knee. I worry about irritating the skin before surgery, so have an audible pop and pain in my knee while standing. The doctor wants to put a gel shot in. It depends what's going on, and thanks, Ray. It depends what's going on. Gel shot helps with lubrication and nutrition to the joint, and so that can be helpful. Do I do revisions? Yes, I do revisions. I've done a lot of revisions. I do have people who get done by. I'm a hip and knee specialist, so if there's generalists who do a hip and knee replacement, they may come to me. Thank you for the glasses, Ray. Appreciate it. Let's see. Why would I have severe pain in my hip buttocks? It's not sciatica. There could be a couple things. Your gluteal muscles are back there. If the nerves are irritated, that go to the gluteal muscles that in the lower back, that can cause a little bit of inflammation back there. Sciatica. There's another thing called piriformis syndrome as well that can affect you back there as well. Do I use robotics? So I don't use robotics on my primary knee replacement specifically because the robot, you need extra pins in the bone. The surgery takes longer, and you need a bigger incision. So I'm not using robotics. I have a smaller tear in my meniscus, and now I'm having hip problems. Sorry to hear that. I would get an X-ray of your hip. Make sure you don't have arthritis in your hip. That can sometimes affect it. Let's see. My son broke his femur in half riding his dirt bike. Got a rod and screws, but thankfully a clean break. The clean break is what we call a transverse break. When the transverse break happens, a lot of the times if you put a rod down it, then that'll be helpful to get it to heal. And if he's young, then that usually works pretty well for healing it. Thank you for all the double taps, likes, hearts, gifts. SI joint is fused. Can it cause severe pain radiating to the ankle? Unfortunately, it can, especially if you have progression of arthritis through other joints. Then you can get referred pain or pain down one of the nerves to the ankle. Yeah, I'm in Washington, D.C. and Maryland. What are your thoughts on Supartz injection? They can be helpful in the setting of if you tried a cortisone injection. Levinal Panda asks, do you like Parmesan cheese? Yeah, it's pretty good. If I'm getting a sandwich, I like cheddar, pepper jack, Parmesan. All the cheeses are pretty good. Gouda cheese, I'm a big Gouda cheese fan. Hopefully that answers your question. Sharp pain in the lower groin radiating to the top of the thigh when I step sideways. It may be labrum tear, arthritis, or you could have some hip flexor issues. Those are all in that area. What can be done for arthritis in the hip? Replacement can be done. What to do for bursitis in the heel? So usually something's causing the bursitis. It could be like an Achilles tendonitis or inflammation there. That could be one reason. And, trying to get that taken care of could be helpful. Sometimes we'll do cortisone injections if it's really bad. Do I recommend gel injections? It's something you could try. Will it cure the problem? Probably not. Are my allergies bothering me? Currently, no. I don't really have big allergies that I know of. Let's see. How would a total hip be revised when another surgeon shoved too large of a replacement in? So it depends what's going on. Why are you having pain? Usually if the replacement is, if you're talking about like the cup, like if they put too big of a cup in and it's irritating a tendon, there's tendon injections or releases, or you could revise the cup and change the position. Thank you for all the follows. Top of hand swelling, fingers numb, no fracture. Hard to say what happened. Maybe some trauma. Any advice for someone studying to take the MCAT? I would probably take one of those review classes. I used to teach for the Princeton Review, and the Princeton Review, Kaplan, those are good review classes. I feel like everyone's doing that these days to get into med school. Good question. My mother-in-law had a partial hip replacement and needed to be transitioned to a full. I've had to do that where other people have put in a partial hip replacement. The patient came in with pain, came to see me for a revision, and I converted them to a full. Obviously, that's not what you want, so most of the time I'm not doing a lot of partial hip replacements. I'm really doing a lot of totals. Just diagnosed it with Kindbox, classical musician. Am I screwed? No, Kindbox can... it can be a low level of disease. There's different things, like different procedures that can be done to try and get to get that bone to heal. So you're not screwed by any chance, but definitely follow with a hand surgeon. You want to make sure you don't get the Kindbox doesn't progress and get worse. That would be an indication for doing a procedure, or if you just have a lot of ongoing pain. Is the spinal surgery for spinal stenosis in the lumbar region complicated? It can be complicated and painful. I would try and avoid spinal surgery if you can. Having hip replaced next week, I'm very nervous. So it's not uncommon to be nervous for hip and knee replacement. I have really good guides on my website. It's matthewharbmd.com/links. I have my hip and knee guides on there. Those are very helpful. People tend to like them for getting their question answered, making them feel more comfortable. I have a lot of videos on here and on YouTube for hip and knee replacement. She has a lot of pain in the knee since the fall. MRI showed nothing. Doc is not sure why. It's really hard to say. You could try an injection in the knee, see if it calms down. Any experience with leg calf Perthes disease? Yes. I have a lot of experience with LCP disease. Perthes tends to cause collapse and can cause a hip replacement within, on the ages 25 to 40. It depends on the level of disease, but it can make you need an early hip replacement if the collapse is bad. Every Perthes is different. Every Perthes has a different level of collapse. Sometimes they'll do braces for it as a child to try and prevent it from getting worse, and it tends to burn out as they get older. Am I a hip or knee guy? I do both hip and knee replacements. What are your thoughts on the conformist knee implant? It's a lot of money. It costs a lot. There are no better results for custom knee replacements, meaning like printed or manufactured knee replacements compared to... I do a custom fit for all my joint replacements. I use a computer to template it. So there's a lot of marketing there. So I don't do a lot of conformists. Trigger fingers, how to fix. You could do injections for trigger fingers. Where's my practice? I'm in Washington, D.C. and Maryland. Hey, what's up? Thanks for joining. What is Perthes? So Perthes is what's called, the hip is a ball and socket joint. And when you get collapse of the outside portion of that ball, that's called Perthes. The thing is, Perthes happens in children, usually on the younger side. It can be anywhere from like 6 to like 9 years old, sometimes even a little younger. But it's basically collapse of the hip socket bone when you're a child. So there's different, the biggest hip problems are what's called DDH, which is developmental dysplasia of the hip. The second one, and the other second one is Perthes, and the other big hip condition is called a SCFE, or slipped capital femoral epiphysis. And so those are kind of the biggest hip conditions in children, and Perthes having that collapse, there's no real reason why it happens. It's likely a blood supply issue, a growth plate issue, is not getting enough blood to the ball and socket growth plate, and so that causes the hip to kind of collapse as a child. Now there's different levels, meaning some people can have full collapse of their hip socket, and some people can just have a small amount of collapse of their hip socket, and that translates to having different problems down the line. Should I still have pain 8 weeks after a partial knee replacement? The important thing is if your pain's getting better. If your pain was getting a lot worse, that would be a big issue. If you're still healing at 8 weeks, it's not uncommon. How to avoid knee replacement surgery? Don't smoke, control other medical problems, exercise, maintain a good weight. I recently had a radio frequency ablation in my SI joint in June. It's still uncomfortable. What can I do? Hard to say that. They could try a cortisone injection in your SI joint. I don't know why they would do a RFA of your SI joint. Cortisone injection, see if cortisone injection helps, then the problem's in your SI joint. If you inject the SI joint and it doesn't help, the problem's somewhere else. Yeah, all of my patients can walk. They're up and walking the same day after their hip or knee replacement procedure. My wife is having a knee replacement on Wednesday. This is her second from a different doctor to do most of the surgery, but do them the same. I wish her the best of luck. I have really good guides on my website. Every knee is different, meaning if you've had one knee replaced, it doesn't mean that the other knee will be more difficult, but it's never the same. I have one hip that sits higher than the other. Could that have happened as a child? Yes. So if one hip sits higher, there's something called DDH, or dysplasia of the hip. And so that can cause a problem, and have one hip sit higher. That doesn't, it's not really a problem, meaning as long as you're fine and okay, then, or not having issues, it's okay to have that. I had a total hip replacement and a limb lengthening from Perthes 10 weeks ago. I'm 57, yeah. So one of the, Perthes leads to replacement. If you made it to 57 with the Perthes hips, that's great. So hopefully you're doing well. Hopefully your legs balance out and are even. I'm 7 years old. I exercise 5 days a week. I have no pain at all. I was told not to exercise 5 days. I disagree. Exercise is good. If you can exercise, do it. Stay active. But you can do all that stuff, meaning you can do everything perfect and still develop arthritis, which is unfortunate. What are the benefits of hip resurfacing versus total? There are no benefits to hip resurfacing. It is a metal-on-metal implant. The idea behind hip resurfacing was that you take less bone. That hasn't been shown to have an issue. The hip resurfacings are not lasting as long as total hip replacements, and the hip resurfacings are made out of metal on metal, so it's a procedure that is becoming extinct. What do you think about leg lengthening surgery? I don't recommend cosmetic leg lengthening surgery. Thank you for all the follows. I appreciate it. Does glucosamine really help? There's not good studies on it. I do have some patients who take glucosamine who have relief. The hip that's higher is painful. It depends. You can get an x-ray or MRI, see if there's arthritis, and then make a decision based on that. Total knee last December. I'm walking and swimming. That is great to hear. How do you create the template for the knee, or do you use Stryker equipment? So what I do is I have a marker in the office, and I take an x-ray, and then I have some computer software where I can use that x-ray to actually template and put the implants on the computer screen to overlay. And then what I do is I get an idea for the size, and then I match that size up in the operating room. So that's the computer templating navigation that I do. Will meniscus tear heal on its own? A lot of the times it can. I have a tear in my labrum off my hip. Do you think it's possible for me to come back and play sports? It depends if that tear gets worse or not. A lot of the times labrum tears in the hip can heal up. But I'll get on and do more of these lives. I appreciate it. If I didn't get to your question, go to my link in my bio. You can always drop a question in the Discord channel. You guys are great. Thank you for all the support. And I'll get on. I'll do more of these. So if I didn't get your question this time, either drop it in the Discord or I'll answer it. So I appreciate all the support.